Good evening, my beloved colleagues, and welcome to all of you to today's session. And this is my humble introduction to all of you as before. And today we design actually to talk a topic which will be very useful in AKT exam as well as OSCE. That means the practical part. Moreover, it will be useful for you people in your practice as a general physician, that is management of infection in pregnancy in our general practice. And those who are regularly practicing and seeing all categories of the patient in your center, in your chamber, might have such patient. Pregnancy with other issues, especially complication. Pregnancy is a big topic and there may be many other issues. And the pregnancy with any other issue should be dealt in a different way, special way, not as usual. From there, we selected a topic which is very important in your exam. For this reason, our target of discussion today will be on pregnancy surrounding, not beyond pregnancy of infection. That means today's discussion will not be basically or totally a topic on infection. Rather, we will highlight the pregnancy with infections issues. And for the reason, we hope all of you will be interactive and connected. Whenever you talk more, you will learn more. This is very rule. So if we start with the information here, how fetus is affected by the maternal infection. This actually our talk today. You see, in the early pregnancy, maternal blood is stream. The infection carries transmitted to the fetus through placenta. There may be placental damage or there may not be placental damage. And in another way by amnion, the chorion. And very easy to understand that from there, in the maternal genital tract, baby may be affected if the chorionic membrane is ruptured easily. So passage through ruptured chorionic membrane, infection will come out through the amniotic fluid to the fetus. Okay. And there are other ways also, infection of chorionic villus, blood and membrane, and the passage without membrane. Whatever the ways, it is not main issue for you as a GP. Just this is the inner informations how infection is transmitted to the fetus. So now you understand that when we deal a case of infection in pregnancy, we must consider the condition of the fetus inside. We will try our best today to give you the informations, very practical informations regarding this. Now have a look, the hematogenously acquired infection and acquired by ascending infection, that means by the genital tract. No need to remember the exhaustive list for you, rather remember that in the hematogenously acquired infection, these are mostly virus. And the important virus are highlighted here for you. And we will try to give you important messages about those viruses today. And during pregnancy, the mnemonic very popular is the torch. These are organisms which is transmitted to the fetus if mother is infected at the time of pregnancy. This is the torch. Another word we can remember as a mnemonic is the chip. So you can remember a more number of organisms. And you can see there mostly these are viruses. Mostly these are viruses. Again, during birth, suppose mother is infected at the time of pregnancy, if it is a chronic infection, then fetus is affected at the time of delivery or around delivery. If the acute infection, some organism does not cross the placenta, if it does not damage placenta, in that case, mother will recover by herself by the treatment. But those organisms which will persist in the blood, it means that the organisms causing chronic infection in general, it can affect the fetus, that means the baby, at the time of placental separation, mostly. Or we told you that the rupture of the amniotic membrane and there are some other ways also. A little part of infection organisms, rather to say, that affect the baby even in the breastfeeding time. So we will be highlighting especially the pregnancy time, which infections affecting the baby here. So again, the infection can be transplacentally. That means a baby will have the disease at the time of newborn or the neonatal period. The reason is that baby is affected, infected organism transferred transplacentally, perinatally by the vaginal secretions or blood, or postnatally from the breast milk or other sources. And the clinical manifestations of the infections, that means the neonatal infection. And remember, it is not only the neonates are affected, the disease manifested in the neonates. Rather, some diseases causes damage of fetus inside the utero as well. There may be death inside the utero by the infectious agent. And for that, the agent and the gestational age we need to consider. Which agent and which age of gestation the mother is affected with depends upon that the baby will be affected. We will tell you a little also with some examples today. And a risk of infection inversely related to gestational age. It means in the first trimester, the risk for the infection is highest. That means the early part of the pregnancy. So if you come with one by one now, and please always you will be interactive. If you know, you can share with us by opening your audio. So first of all, if we deal a pregnant mother with a rash, definitely very important in your AKT exam as well as in the OSCE also. The OSCE, in the OSCE, it will be proxy case, mother will be talking to you that my baby has some, I am having rash or I am exposed to rash. So you see the meaning is here, pregnant woman in contact with rash. What does it mean? Please, can anyone say? What do you understand by this? Woman in contact with rash? The mother is affected or not in this condition? Yes, Dr. Nasir, you open the mic. Again, close.
Yes, sir, Dr. Osman.
Yeah.
Yes, most probably this kind of rash, especially they are aware of chicken pox.
No.
So,
Sorry, doctor. What is the meaning of the woman, the pregnant woman, in contact with rash? Contact means the pregnant woman
very,
already affected or not?
yes, the person to whom she contact, it is a close relative and she know that she is in contact.
Relative
This
is
is,
diseased. Relative is diseased.
yeah,
But the pregnant lady is diseased or not right now? If we
no,
say the
no,
word in
no,
contact?
no. She is in contact, but she is not in disease process, right?
Yeah, thank you very much. Thank you very much. That means apparently a healthy lady we are discussing with and we are planning to give the treatment. So treatment will vary in the contact. Contact means actually pregnant woman is in contact. That means pregnant woman is exposed. Another situation, the pregnant lady already affected by the disease. And you know that suppose dengue or pregnant lady already developed chickenpox or herpes zoster. So it will be the disease. So we are now talking about the disease right now. We are talking about the contact. So try to understand the meaning of contact when we will say this is clinically significant contact. Please have a look in the screen. If both person living in the same room, house or the classroom, that means the class is school class, and staying more than 15 minutes, it is not very close contact, even in the same house or the same room or even in the classroom. That means the teachers or students, this is an example of contact, important contact. So suppose now pregnant lady has one baby inside the uterus, another baby age of 5 or 6 years, this baby has the chicken pox. So the message, the description telling that this is a significant contact. Okay. If it is so, this is the duration or face to face, just close together, face to face talking on the beside the tables. This is face to face contact. From there, some disease might be transmitted to mother, the pregnant lady. In this case, if it is a rash, there may be rash with vesicle, without vesicle. So now we are thinking about some common diseases. The mother exposed to a person with another person having a rash, but it is not vesicle. This algorithm is showing. Please, all of you, look at and ask me if you don't understand anything. They are describing now about measles, and it's very common in the exam, AKT or OSCE, whatever it is. Please look at and ask me. I will jump. Dr. Mahwish, if you don't mind, can you open mic and tell me what is the message here? Dr. Mahwish Omair. I hope that all of you spared your valuable time for the session today. Anyone, please, can you open to be volunteer here? No one? That means you understood. You understood.
No, sir, I don't
Huh?
understand this
Please,
chart.
please,
Please,
please, please.
sir, you can teach us. I don't understand this
No,
chart.
that is understanding is important. You will be reading your book, right? Not that you will learn only by my voice. This is this vaccine 2 times given, right? 2 vaccine, 2 dose given, measles. Whenever mother is affected, we will consider to give immunoglobulin or not of the disease in general. But to decide this, we have to consider something. Already we considered the contact previously, the significant contact. Now, is pregnant lady is immunized from before or not? To explore this, what we are taking, we are taking the history of previous vaccination, measles vaccination, in a form of MMR in general, right? In the South Asians, even throughout the world. If 2 vaccines given before to the pregnant lady, that is the mother we are dealing, we consider she is immune. So if she is immune, no need to be worried. If she is immune, yes, no need to be worried. Reassure, measles unlikely. Unlikely means mother will not develop measles, more likely. Clear, Dr. Nasir? Please, Nasir, be connected with me better.
Yes, sir.
It will give me energy, right? Okay, I am talking
Oh,
lively, I will feel. But,
oh,
but, but, there is no history of vaccination. Okay? So she is actually not immune. There may be some other hidden issues also. What is this? To say mother is immune, other than vaccination, this is mother herself affected with measles before and survived, right? It is not written there. Understand, Dr. Nasir?
yes, yes.
It is a natural immunity already developed. So they are
Yeah.
highlighting the vaccination because measles actually previously happened or not. It's not easy to get. Mother might forget. Mother doesn't know the diagnosis, what happened wrong in her previous life. There is a drawback in history taking, but vaccination history will be very clear. So
Yeah.
if somehow mother is not immune, then contact has confirmed or likely measles. That means mother is actually contact, and that means the clinically significant contact, okay, of the measles person, and check IgG. That means documentation. IgG against measles. Okay. That means the mother has likely measles before. Mother may not have enough antibody today also. In that case, better to check IgG. I'm going back. If vaccinated, no need to check further. In general, otherwise, there may be some other drawbacks. If mother now immunosuppressed, in that case, we need to check IgG level also. This is not mentioned here because we are actually dealing your GP level as well as thinking of your future exam, AKT or OSCE. So we are not discussing too much detail. Just more highlights, more the gross informations, try to understand. This basic discussion will remain almost same for other disease also. So try to remember. First is the history of contact, significant contact. Second, status of immunity. The third will be the basic principle, consequence of the disease. Suppose today, if mother is affected or mother develop measles, how it will affect mother as well as the baby or fetus inside. Considering these three things, we will consider for giving immunoglobulin treatment or not. This is the basic idea for discussion today. I hope all of you understood this now. Okay, Dr. Nasir, for the measles here.
Yes, yes.
Thank you very much. Thank you very much. So you see again the immunoglobulin, that means the antibody level is high up, then reassure mother, don't worry. Now come to the another disease. This is rubella. Okay. That means this is non-vesicular rash, exposed to non-vesicular rash, another person. So again, we will check the history of vaccination or the antibody status or antibody level. You know that in the pregnant lady, it is our common investigation plan to include the rubella antibody, right? Dr. Nasir, what do you do in your practice?
Yes, sir.
If you see the pregnant lady, those who are looking the pregnant lady in your practice, I think you know, all of you know, and today we are knowing the rubella status, IgM or IgG. We will check. Usually we check. So past rubella antibody positive, if it is the titer is more than 10, okay, more than 10, and it is found 2 times. 2 times. This is antibody level. In one way, we consider mother is immune. Another way is rubella containing vaccine, one vaccine. One vaccine given plus antibody level titer 1 time more than 10 unit. This is a scientific calculation and we need to remember it. Okay, we need to be very scientific by memorizing this. Or the lady got 2 vaccine of rubella. Rubella means again measles, mumps, rubella, MMR. So if 2 vaccine, we consider mother is immune. So the basic principle again the same, that if condition is correct, mother is immune, reassure rubella infection is unlikely will happen. Okay. Now another disease, it is not much common. So, but the clinical situation is like rubella. For that, we have to consider another parvovirus situation like antibody and others. So we are not discussing too much on parvovirus today. It is South Asian culture. If anybody can share in South Asia, have you seen parvovirus infection? If anybody have seen, you can share today. But approach is like rubella. Okay. And again, if mother is not immune, then investigate with rubella and parvovirus serology. Okay. That means you are confused again also. No means you are not confident about the message. That is the immune status. Then You need to check patient developing rubella in future, as well as you can check the rubella antibody today also, if you don't get the history like that before. So rubella and parvovirus having the similar appearance for that. Now, what will you do? If you can prove this is rubella, your job is to refer. And now the consequence, example of consequences. When the fetus will be affected more, very popularly congenital rubella syndrome. So baby will develop congenital rubella syndrome if mother is affected before 20 weeks of gestation. It may be at 12 weeks, it may be at 10 weeks and others. And I told before, usually risk of infection is more if the infection happened early in the pregnancy. Clear, Dr. Nasir, now?
Yes, sir.
In the decision making, in your question, we have to be thinking significant contact, immune status of the mother, and the age of gestation with consequence of the disease. So consequence indirectly related with age of gestation. That means the disease affecting at the age of gestation. So this is not fixed, 20 week, 18 week. This is related, this week is related with the rubella. But we know the basic principle. First trimester is always a dangerous trimester, right, Dr. Nasir? First
Yes, sir.
trimester, very dangerous, especially for the baby. This is the time of teratogenesis and other, mainly. Now, come to a case. That means a question of your exam. May I request Dr. Nasir, please? Can you read it for us?
Yes, sir.
We will be happy if other colleague also come forward to talk with us. Please, Dr. Nasir, now.
Yes. A 34-year-old pregnant woman comes to see you in the clinic today concerned as her brother's son has just been diagnosed with rubella. She is 9 weeks pregnant and is unsure of her rubella status. What is the most appropriate first step to take at this stage?
Yes, as a GP, what step you will take? What will you say? What will you do? Please, anyone can answer? Now, this is your time, your turn, because you are appearing the exam. You must answer it. Otherwise, we'll never attempt your exam in future. Please, anyone?
So
Dr.
need to
Ashraf?
check. So need to check rubella virus test.
Need to check rubella virus or need to check the antibody level or immune
Yes.
status of the rubella of the mother?
Yes, sir. Yes, sir.
Why? Why?
So because she is unsure about rubella status.
Unsure. So can you tell me what are the keywords here? You identify one keyword is unsure of rubella status. Any other keyword?
9 weeks.
Very right. Age of gestation.
Yes.
Age
Yes.
of gestation. So if first consider especially the keywords will be age of gestation, another is unsure, another is the contact. Do you think that brother's son has just been diagnosed with rubella? It will be very important contact for pregnant mother today.
Yes, sir.
Why? Brother's son is a family member, maybe in the same house for that.
More
Yeah.
than 15 minutes.
These are the clue be given in your exam. Please be serious about that.
Yes, sir.
And rubella at itself a disease which can bring a very bad consequence, right? So considering this thing, we need to be aware of such clinical situation. We must treat mother. If any indication of immunoglobulin, we must give. But is it important or not? Actually, we are not too much confident because we are not sure about the immune status of mother. Right, Dr. Ashraf, you mean like that?
Yes, sir.
For that, you will now check the antibody level, you mean? What do you
Yes,
think? You are GP, don't think you are a specialist, okay?
Yes.
Your facilities, privilege, we have to thinking that we are GP. Other colleague, what you are thinking now? Dr. Ashraf already given a decision. Any other colleague wants to give any other decision?
Yes,
Dr.
I think
Javed?
we'll do IgG level of
Again, the
rubella.
same, you're telling the same. Any other
Refer.
option? Any other than this?
Refer.
Possibly other colleagues are thinking the same.
Yeah, to take a proper history of that.
So these are the options in your exam. Now this is exam question. Up to this, remember, I hope some of you are appearing for this OSCE. This is the OSCE pattern question you are asked. No option be given in your OSCE station. So you must give your answer to the patient. Now it becomes an AKT exam question. I hope all of you understood. Now you can choose here now. Please, other colleague, until you didn't tell now, you can tell by looking there. What will you do now?
So E, I think E, admit to hospital.
Urgently, something happened very wrong now?
That B,
No.
sir.
No, Dr. Javed. Why you are thinking urgently hospital admission important?
Because she is first trimester pregnant and exposed to rubella virus. But if we check the antibody level, if it is positive, and then I think she will be safe. Otherwise,
So you are thinking that you will advise her, go to the hospital and got admitted. They will check your rubella status. This is the indication
yes.
of hospitalization.
No.
Dr. Javed, for checking
Yes.
only, we will advise patient to be admitted.
We will refer. But here there is no, I think,
See.
the option, there is no
See.
only refer.
See, there is a technical option. C. Technical option C means
Yes, sir.
discuss immediately with the protection unit, health protection unit. It is not very well-known word in our South Asian perspective. But thing is that health protection unit, that means we will discuss with someone expertise of that topic. Understand, Dr. Javed?
Yes.
As there is no option that I will check antibody, I will check immune status. If it is so, it will be the good answer, no doubt. But indirectly, actually, they are giving another option. A, B, D, E, not appropriate answer here. So we have to consider the C indirectly. We will consider to discuss with the health protection unit. Actually, our agenda is to check the immune status of mother. I think now clear, Dr. Javed.
Yes, clear.
So
Thanks.
these are the technical things we need to learn for exam. Not only knowledge here, right? We need to know about the technique of the options in the question.
And
I
sir,
hope-
please, is there any time duration till then the female can do this checkup, everything, or if maybe
No time or
any?
duration needed here as early as possible because rubella outcome is very bad. We need to diagnose the rubella possibility first. Mother will be affected with rubella or not. She may not be affected, right?
Yeah.
For that hospital admission not needed. She may not be affected. If the immune status is good, I will assure, don't worry. I will keep you follow up in outpatient, in the outpatient follow up. Okay? On it. But immediate checkup is important. So please try to remember this thing. This principle always remain the same for other diseases, especially chicken pox and others. And we will try to give you a very good outline of the viral diseases mainly with other some non-viral issues. So these are the discussion. I think no need to discuss further. Already we discussed. You will learn by yourself from a question bundle. Rubella pregnancy, no need to read here. But the rubella is similar with parvovirus. Okay, clinically not easy to distinguish. So we need to check the blood immune status and others for the parvovirus. And parvovirus actually erythrotopic virus. It kills the RBC, especially RBC, parvovirus B19. Okay. Now another disease, the rash with vesicle. More likely, commonly, what is that? Dr.
Herpes.
Ashraf? Herpes. It may be
Herpes.
varicella or herpes. It is a different presentation, but organism is herpes. What is that? Herpes. The name of the virus?
Zoster.
Varicella zoster.
Varicella zoster.
Is it? That means the varicella virus. Varicella virus. One of the type of herpes virus, varicella virus. So if the varicella, that means the chicken pox virus, or the rash, that means actually rash of not mother. What we are discussing, rash of other person. Mother is apparently healthy. We are worried about the mother health for the future. Now again, immune status. Reliable past history of varicella or herpes zoster. And you know that if anybody have the chicken pox in life one time, he or she will remain immune throughout the life. Almost, it is true. Nothing is 100%. So it is area of the reassurance. No, don't worry. Right, doctor?
Yes, sir.
And for our Arab colleague, I am telling, La mushkila, maafi mushkila. That means I will explain to mother. Now, I am uncertain. Past history of varicella or herpes zoster. And it is the very reality. The people forgotten in the childhood what happened. We are discussing the mother at the age of 25, 30 years, 35 years. So we are confused, mother confused. You have to be confident. If confused, then definitely I will check immune status by the blood test by varicella immunoglobulin. Please, any doctor, any colleague here, can you share? Anytime did you check varicella antibody in the blood of a pregnant mother? Please. If anybody, you can share your memory so that we can learn from you a little. Why you have checked? What was the indication? Can anybody today? No one. You are reading the book only, not facing. Really, everybody cannot face such situations, especially the females are not coming to the male doctor in general, especially in the South Asian. Is it, Dr. Nasir? Dr. Nasir possibly from South Asian origin, right?
Yes, sir, I am from Pakistan.
So in your culture, do you think that the ladies are coming to the gents? Less likely,
Yeah.
especially the
Yeah.
pregnancy issue I'm talking about.
Yeah. Only go to
They
female.
are not coming. Very few in some situations. For that, in Arab also, there's a very strong, again, cultural orientation. For that, actually, most of us possibly not facing such situations, but these are very simple thing. We need to learn. We need to learn to face the clinical situations and for the exam as well. Anyway, again, the same principle. Varicella antibody detected, reassure. Not detected, then give varicella immunoglobulin within 10 days of contact. This is special message for the varicella. Okay, within the contact. Otherwise, the patient will develop the disease more likely. After the exposure, within 10 days, we have to attack the disease. For that, remember the 10 days. Another message I will share a little later. First, remember the 10 days. Irrespective of gestation and investigate as necessary. That means the other investigations, if you think you can do. Okay. So this very, very basic principle you understood from the rash, contact with rash. So overall, this is the algorithm. You can make a snapshot from here. The total informations you will get here. Now come to measles with some informations. And you know, measles presentation, we are not discussing about the clinical presentation, just information sharing related to the pregnancy. If infection in the pregnancy, it can lead to intrauterine death and preterm delivery. That means the consequence is very bad. There are no association with congenital infection or abnormalities. What does it mean? The measles mother can cause the death or delivery, preterm delivery, but after the birth, there is no association with. This is the message that I told you. The baby or fetus be affected during pregnancy time or after the delivery, or sometime both can happen. That is the effect at the pregnancy time as well as after the delivery. But some diseases causes problem after the delivery only. Some disease causes problem before the delivery only. This is, you see, already you have seen there. This is also informations for your exam. Okay, when in the OSCE you are facing, you have to assure the mother or you have to inform the mother in this way. Okay. Now, human normal immunoglobulin, if baby delivered, if we know that mother affected by the measles, then we have to give human normal immunoglobulin to the neonate 6 days before the delivery and or within the 6 days after the delivery. So total how many days, Dr. Nasir? The perinatal time around
So
6 days
12
plus
days.
6 days, 12 days. So we need to remember it also. Otherwise, the medicine will not work. Okay. And if mother is not vaccinated, then we have to give MMR after the pregnancy is over, vaccination after pregnancy. So this is the treatment of the mother, treatment of the baby in case of measles. Now come to chicken pox. Invariably, you will get the question of chicken pox in the AKT as well as in OSCE. Almost 99% certain, remember. So you need to read more about the chicken pox as much as possible. We are trying our best to give you some highlighted message. So chicken pox 2 days before the rash appear until the rash has finished cropping and crusted. This is the time of the transmission of disease. How we will utilize it in the OSCE? The message. Please, anyone can say those appearing in the OSCE? Please, anyone? This message, disease will be transferred 2 days before rash and for how many days? Until rash has finished cropping and crusted.
7.
How we will utilize the message in OSCE station? You are talking to the mother. Nobody is here appearing for the OSCE. If you cannot imagine the OSCE situation, how can we appear? That is, you are dealing a pregnant lady, for example. Okay. You are dealing a pregnant lady. Lady is telling that, doctor, I was in contact with a chicken pox patient. We have to be sure the chicken pox, is there any chance chicken pox transmitted to mother or not? Organism transmitted or not? We have to be sure. So we need to ask when you got or when you were in contact with chicken pox. That means the patient is in the disease state after the crusts are over or not. If crusts are over, crust finished, the patient wasn't actually in the recovery time. So it will be good reassuring to the pregnant mother. Clear now, Dr. Nasir?
Yes, sir.
Yes, sir.
In every disease, if possible, try to remember the period of infectivity, clinical period of infectivity for every disease. So it will be very burden for you. So technically, common diseases, period of infectivity of common diseases, transmissible, especially the viral diseases. You have to remember. So this is one of that info, the 2 days before rash and up to the appearance of the crust, that is the crust form dry. And it is important in your practice to give the sick leave or isolation. Is not it, Dr. Nasir? That how many days you will advise for isolation from the school or the job? It depends upon with this message. Incubation period is not same as infection period. That is period of infectivity. This is incubation, you understand? Entry of the organism and appearance of the clinical manifestation. This duration is incubation period. Now, preconceptual prevention, that is important issue for the chickenpox is the lady is going to get married. Okay. If she is not immunized, tell the lady be immunized and delay your marriage day minimum 3 months. Pregnancy should be avoided for 3 months after the immunization. Okay. But technically, if she says that, okay, I will not be pregnant, can I get married? What do you think, Dr. Ashraf? I will not be pregnant 6 months or 1 year after my marriage.
Possible, sir.
So will you advise, okay, you can take the vaccine now and you go for the marriage? Is okay?
So yes, sir. If she not in
Yes,
in
yes.
PESCI.
Actually, yes. It's a technical thing. But in general, pregnancy, the marriage means pregnancy. Okay. But
Yes.
if any lady already got married, mother of one child, unfortunately, she was not immunized before. In that case, we can tell that please don't get pregnant. Okay, minimum 3 months after this vaccination. So this is the chicken pox and more information with the chicken pox exposure in pregnancy. Okay. That is again the immune status. If mother had chicken pox before, unlikely that it will cause harm to the mother as well as baby. But if he does not recall chicken pox, then check her immunity. Again, the basic principle. In case of at-risk exposure, already we described significant contact. Okay, what we will give. Treatment is already we told before, within 10 days of exposure, we will give varicella zoster immunoglobulin. Okay. Now, when baby will be at risk, if mother develop chicken pox from 7 day before to 7 day after delivery, that is again 7 plus, that means plus minus 7 days, plus minus 7 days. Okay. Then baby will be at risk of developing chicken pox. Mother is not immune and the baby is exposed to chicken pox within 7 days after birth. So these are some conditions. You better to make a snapshot. You will remember by yourself. Remember by yourself. Okay. And there's some technical condition also in the bottom, please. Actually, I cannot switch also. The technical message is that mother has antibody. That means mother is immune before. Even then, baby may be affected. In which situations? Preterm baby. Baby weight less. Baby got blood transfusion. Okay. In this situation, if there may be chance of infection of the baby as well. So varicella immunoglobulin can be given without antibody testing to these babies. If the baby's condition is as such, mother is affected, right? Mother is affected. In this situation, we have to give actually the antibody in such situations. And antibody to whom? Antibody to baby as well. Immunoglobulin to baby as well. Okay. Now, the question is, if you give one injection of immunoglobulin of the varicella, what is the duration of its action? 3 weeks. 3 weeks. That means if mother again come into contact with again the varicella within the 3 weeks, no need to give immunoglobulin. But it is if mother become exposed or came into contact after 3 weeks of the first dose, again we have to give the immunoglobulin. So 10 days we told before, that means varicella zoster, after the exposure we have to give within the 10 days. It is one message. Another message, if I give varicella zoster immunoglobulin today, it will work for 3 weeks in future. This is also exam question. Now, the plus minus situation, some author telling that give acyclovir antiviral for women with significant additional risk factors. This is a special issue. Immunosuppression, a smoker, again, we might ignore it, smoking. Women who did not receive early varicella zoster immunoglobulin, that means the early time within maybe in the 9th day, okay, or in the around 10th day, in such situation, we can give immunoglobulin plus antiviral. And those in the second half of pregnancy. That is the second half is important that we discussed before. The age of gestation is always important for the disease. It is in the first half of pregnancy or second half of pregnancy. That means the varicella zoster in the second half is very important, clinically very significant. In such situation, we have to give the prophylactic antiviral medication also. I can remember in our previous recall classes, we discussed about we have to give immunoglobulin as well as acyclovir. But unfortunately, I cannot remember what was the exact question. Age of gestation and other possibly was there in the question. So if the disease already developed, this pregnant lady especially prone to develop chickenpox pneumonia. You know, pregnancy itself a state of immunosuppression. So chickenpox will be skin disease. Skin disease means nerve fiber actually. The nerve, it is affecting the nerve, but it can affect the lung as well. It is a chickenpox pneumonia. It is a dangerous one. For that, we need to give the prophylactic treatment to save the mother as well as the baby. Okay. Now the management. In the confused situation, we need to confirm the disease. Okay. There are some tests. And if you're confident, then give the treatment for if you give acyclovir 800 milligram 5 times a day for 1 week. So these are some conditions. Please remember within 24 hours after rash. Okay. And the mother is more than 20-week gestation. Mother is in more than 20-week gestation. That means you understand that chicken pox is bad at the second half of the pregnancy. Okay. If within 28 weeks of gestation, then refer for detailed ultrasounds 5 weeks after infection to exclude fetal varicella syndrome. So maybe new word to you like rubella syndrome. It is congenital rubella syndrome. Now we are telling not congenital, rather fetal varicella syndrome. You will read by yourself clinical features of fetal varicella syndrome by yourself. So this is the protocol or guideline, whatever you say, the management planning for the chickenpox disease. Chickenpox disease. That is mother already developed disease. Then what will happen to the baby? Now, if mother is pregnant and she got the chickenpox, not only chickenpox, any other transmissible disease, we need to advise mother not to go to contact with other pregnant lady or other person also. In general. This is the social protection. As a family physician, this is your responsibility to tell it. Remember it. So still we are with the chickenpox. So maybe we are repeating the messages. Transmission higher later in pregnancy. Within 20 weeks, that is before 20 weeks, there is a chance of miscarriage, fetal varicella syndrome. And after 20 weeks to 37, intrauterine infection and death. And baby born, there will be the shingles in the childhood. Okay,
Sir,
please.
sir, if doctor, if patient is a doctor, how can she go to not to go or go to hospitals or that period? How can
Patient
I?
doctor mean you mean that the mother, pregnant mother, she is a doctor?
Yes, sir.
No. If she is a doctor, that means she is in contact. Okay.
Yes.
You have to consider her as a patient, not doctor. That means doctor will think herself as a patient. What does it mean? If you for that we use the word preconception counseling, premarital counseling. This word is actually now very much prominent in our society. We are ignoring this. Before the marriage, we have to make a counseling session. And before being pregnant also, we need counseling or discussion that if in the area where the chickenpox is prevalent, suppose in your area, Dr. Ashra, for example, if chickenpox is prevalent, right? It is
Yes,
not
sir.
uncommon. In that case, if a lady trying to be pregnant, she is to consider that is she immune to the chickenpox or not. Why you don't see more chickenpox mother? Because most of the ladies having chickenpox in the early childhood. Naturally, they are immune. We are not checking also antibody. Fortunately, they are immune. For that, they are not developing chickenpox. Even the doctor is a pregnant mother. Understand?
Yes, sir.
But in uncertain situation, before being pregnant, check antibody level. So now you understand how many diseases you will be checking for the antibody level of many diseases if you are not. But actually we are protected by the mercy of Almighty, by nature,
Yes, sir.
by nature. So again, 1 week before or after, 1 week after. Easy to remember in most of the diseases, 1 week before delivery, 1 week after delivery in general. This is a very critical time. All babies should be given varicella zoster immunoglobulin if mother is affected. In addition, acyclovir to varicella immunoglobulin. When? If the onset 4 days before delivery or 2 days after delivery. Onset means mother developed the rash, mother developed the disease. Understand? Dr. Ashraf?
Yes, sir.
If mother developed the chicken pox 7 days before the delivery time, within 7 days, not beyond 7 days. So after the delivery, we will give varicella. Okay. But if within 4 days or 2 days after delivery, we need to give additional acyclovir. This is the AKT question. Possibly we discussed before. So long discussion happened about chicken pox. Now look at a clinical scenario or question of your exam. Who will read, please? Other colleague, Dr. Rafia, please.
A 14 weeks pregnant lady 3 days ago was childminding her niece who is suffering from chickenpox. The patient spent several hours with her niece and engaged in close contact such as hugging. The patient feels well in herself and has no symptoms of note. She is uncertain if she has experienced chickenpox in the past. Given the above, what is the most appropriate course of action?
What are the key words here? Dr. Rafia, keywords. That means
Keywords
diagnosing the disease and the management planning. What informations are important for me as a doctor here?
contact history.
Is it significant?
Yes, sir.
Okay, then please everybody share in a group.
Gestational age.
Age, which age? Any age given?
Gestational age.
14 weeks, right. So this is in the first half. We know that
Yes.
in the second half is more dangerous. Even then, first half is not immune. First half also important. Okay, then patient
Sir,
having any immunocompromised state or not?
Yes, sir. Pregnancy is
No, other than pregnancy, is patient immunocompromised otherwise?
mm,
No.
No, why no,
no.
Dr. Ashraf?
no,
Patient
and-
feels well. Patient feels well in herself and has no symptoms of note. It means she is not sick otherwise.
Yes.
Any other message?
the nice suffering from chickenpox.
This is the history of contact, detailed history. That means you understood that this is significant contact. The whole sentence giving you the message, this is a significant contact. And then any other message we need to pick up from here. Dr. O.
Yes, sir.
Muhammad, please. The mic is open.
Uncertain of has experience with chickenpox in the past.
Yes, she's uncertain if she has experienced chickenpox in the past. So what the message is that the immune status of the mother is not certain. Very good. I'm happy, doctor, as you said it, because I tried today to put this message in your brain. The basic thing of this. Uncertainty of immune status, close contact, several hours with her niece. What is the contact minute, doctor? Minimum? In the same
15
room,
More
same
minutes.
than
house?
15 minutes.
15 minutes. But it is,
Yes.
if the close contact, hugging is that doesn't bother the minute. It is enough. Hugging is enough, right?
Yes,
So
sir.
hours also more, so significant contact. Other messages I didn't highlight for the diagnostic purpose. I didn't highlight actually for the management purpose. 3 days also important. If I consider to give immunoglobulin,
Incubation.
right? Immunoglobulin, sorry, is the 3 days also important? What do you think? Exposure
Yes,
to
sir.
exposure and the immunoglobulin, how many days within we have to give if I consider immunoglobulin?
14 days.
No,
3 weeks.
no, 10 days.
Less than 10 days.
10 days.
10 days. If you give immunoglobulin, it will persist its action 3 weeks. But if you decide to give immunoglobulin, it should be within 10 days of exposure. So this is 3 days. This is also critical information. Clear now?
Yes, sir.
Oh, what will you do? Uncertain? Again, OSCE question like this. OSCE
No.
doctor, please answer. What will you do in this situation? Uncertain, you will make it certain, right? How will you make it certain?
The test.
Yes, advise her
Test.
to check.
Test
Yeah.
for immune status.
Yeah.
Is there any option like that? Or will you give immunoglobulin?
Varicella IgG check.
Yeah. What is varicella IgG check? You look at the screen and tell the answer from there. Don't synthesize your words. A, B, C, D, E.
Sir,
Check.
C, sir.
And
C.
A,
C.
no, A, sir.
That means you will give treatment. Doctor, somebody,
Yes,
Dr. Rafi, are
sir.
telling antibody
A.
level.
Yes,
A.
Yes,
antibody.
sir.
Antibody
Antibody
level.
level. Check.
The-
Yes, sir.
Because less than 3 days, sir.
Good, good. Much relaxed. I am much relaxed now. Really thankful to you. And now I understood. Minimum I am able to make you understand something. Make you understand something. So this is a long discussion, doctor. You will read by yourself. And another message we didn't talk to you. When you decide the acyclovir, better to be given within 24 hours of rash onset. Okay, otherwise medicine will be wasted. Understand? Okay, if you give a acyclovir, and it is a very basic thing. We in our previous time, antiviral for COVID. Okay, for any viral disease, there is a time limit. Usually 4 days, 5 days like that. As early as possible, it is better. If you become delayed, efficacy will be less. For that, for the varicella, it is better within 1 day. But if disease developed after 20 weeks, patient is less than 20 weeks gestation, specialist advice should be sought. That means you will refer the patient to specialist for further evaluation. Please don't think referral means only deshouldering, doing nothing. You have to do your job. Then you will send to a specialist. It is called referral. Otherwise, it will be termed as deshouldering, unprofessional word. Okay. And if already we discussed, if mother is having the chicken pox, 5 times pneumonitis, that is a pneumonia. Anyway, you will read by yourself, doctor, better to jump. We have to say some other words also. Oh, another one. Why wait until 7 to 14 days? 7 to 14 days wait means now the first choice of PEP for pregnant women. We talked about acyclovir within 24 if already rash developed, disease developed. Okay, rash developed. But post-exposure prophylaxis, only exposed, antiviral should be given 7 to 10 days after exposure, not immediately. So there's a tricky thing. If disease is not developed, but we decide to give acyclovir, we will give after 7 days. Explanation is not clear. It is found that it is beneficial. But disease already developed, so within 24 hours. There are two informations. For that, I told you, you need to know more about chickenpox and South Asian countries. I think no country is immune from the chickenpox, right? And even the Middle East countries also. If any colleague from Middle East, you know it. Okay. Now come to the general topic of rash. The which virus, that means rash infections that cause no harm to fetus. Okay, that means fetus will be saved in such diseases. Few examples only. Enterovirus, Epstein-Barr virus, and ecovirus. In these situations, fetus will not have any problem. Hand, foot, mouth disease also. In the exam, in the OSCE, if you diagnose this disease in the mother will be worried as a mother always. Doctor, what will happen to my fetus? If you don't know, you will be confused. So you will not be a good doctor and you will not be a good candidate for the OSCE. Now the genital herpes. Again, contact another, you know. Okay. So what is the message we like to share? Risk is greatest if primary attack after 34-week gestation. After, that is the second half. That means near about the delivery time. And the secondary attack is of less harm, usually by nature. Any secondary infection causes less disease or less manifestations. Okay. So what are the risks? Actually passing the infection to the baby at the time of delivery. So mother having genital herpes, and usually mother transmit the disease in the time of delivery. Or before the delivery, there may be IUGR, if primary infection only, but not secondary. Secondary disease is not too much dangerous. Or patient may have, the mother may have early labor. In this situation, elective cesarean section can be planned, and your job is referral and planning. Especially primary, for the primary attack after 28 weeks of gestation. Please don't be bothered with this memorization for many diseases. Try to remember few common diseases. It will be easier. So for the chickenpox, after 28 weeks means 7 months. So after the 7 months, if primary attack is there, then the first attack, we have to consider elective cesarean section to minimize the risk for the genital herpes. Now hepatitis B. Okay. Again, the hepatitis B transmission to baby occur during labor. That is, this is the peak time. Okay. Peak time. Infants infected at high risk, 90% becoming chronic carrier. This is the effect to the baby. And most of you know, most of you have seen that asymptomatic patient, but they are checking hepatitis B status to go to Saudi Arabia or Middle East country from the South Asian countries. Haven't you got, doctor? What do you think? Any relative even or your patient? Possibly you have seen. I want to share with anyone who have seen such patient. That patient shown a report, HBS is positive. Patient does not have any symptom now, and patient cannot give you any history of jaundice before. Such patient have you seen any time? Doctor, anyone wants to talk to me? Dr. Ashraf.
Yes, sir. Yes, sir. Some patient come from.
Can you remember how many days before? Can you remember the story?
Sir, his history is same like you. Like there is no previous history of exposure, but maybe the sexual exposure is there. I
Could
don't
be
know.
there. I don't know means you didn't ask the
Yes, sir.
sexual history for that you don't know. Okay.
Yes. And
But I'm telling, there is no sexual contact also. Significant, the risky sexual contact history also not there. So how the person got hepatitis B? More likely, Though there are some unknown transmission ways of hepatitis B, but more likely he or she got hepatitis B from his or her mother.
So genetically, sir?
Yes, it is a congenital happening. And this is the scenario. If mother is affected hepatitis HBsAg and she transmit the hepatitis B virus to the baby, usually baby will be carrier. Baby will not develop jaundice. This is a natural immunity actually not developed for that. There is no immune attack after the birth. And the baby body will think that this virus is my own, not foreign. This is the immune pathogenesis. For that, the baby will never happen jaundice. Baby will be carrier. 30 year, 40 year, 50 year after, check and got. It means as a GP, what is my responsibility? We have to screen the family members, especially the mother first. If mother is negative, even then it does not exclude the positive test for other brother, sister. Possibly mother is cured now, but she transmitted all the children's during the pregnancy time. Understand, Dr. Ashraf?
Yes, sir.
I hope
So
all
in
of
that,
you understood.
So in that time, during pregnancy, before delivery, she took any antiviral?
Yes. Now the treatment, how it will prevent the disease to
Okay.
the baby. That is the measure. That is the measure. That is the
Okay.
measure. Okay. And we need to know about the hepatitis B E antigen. This is the marker of infectivity. Only HBsAg is not the marker of infectivity. This indicate the presence of virus. But infectivity, that means not only mother, even any person also, she is infecting other person or not, depends upon the presence of E antigen, envelope antigen. So we need to test hepatitis E antigen also. Okay. So infants infected are at high risk becoming chronic carrier and developing chronic liver disease. Okay. And patient will have early death in later life. There is a consequence of the chronic liver disease. Okay. So if you see seropositive for both HBsAg and HBeAg, those mother will transmit the disease to the baby. Okay. Transmit to the baby. Then if it is so, we will refer to specific department. Infected mother should not donate their milk, remember. It means by the milk, virus is transmitted or not. Dr. Ashraf? By the milk, virus is
Possible, sir.
transmitted. So we will advise not to give milk to other baby. That is maybe some, there is some culture also to donate the milk for social purpose. Other family babies, many other reasons. So if mother is positive, we will advise mother, don't give. And in the OSCE, again, doctor, remember, you have to say to the mother, this is part of your clinical consultation. Now, hepatitis B immunization, how to give. Please, doctor, you will read by yourself. We need to finish as early as possible. Make a snapshot. When to give and how to give immunization to the baby, including vaccination also. Not only immunoglobulin plus vaccination. Both be given. Okay, now come to a case or question. Who will feel better to read? A new colleague, anyone feel interested to read it? Silence always bad. Dr. Ashraf, will you read it?
Yes, sir. A baby is born to a mother who is known to have chronic hepatitis B. The mother's latest results are as follows: HBsAg positive, HBsE antigen positive. What is the most appropriate strategy for reducing the vertical transmission rate?
You understand the question? Mother carrier, right? Chronic hepatitis B. Mother, you check the mother. Now mother actually E positive. So she can transmit the disease now. Understand?
Yes, yes, sir.
Now you can recall The mother is positive, all babies are not positive. How will explain? Possibly that mother has HbS Ag positive, but mother HbE Ag not positive. Understand? For that, in the same family, all babies may not have hepatitis B. The reason is that at the time of pregnancy or at the time of delivery, mother didn't have HbE Ag for somehow. Understand? So HbE Ag whenever there, now mother is risky. Mother is risky means mother almost, there is every chance that mother will transmit the disease to the baby if she become pregnant. Anyway, so question is, what strategy for reducing the vertical transmission? That means in the pregnancy time, how can we reduce? What will you do to the mother or to the baby?
So in vaccines should be
Vaccine to,
given.
vaccine to mother. How vaccine will help? Already mother is affected from before. Vaccine will do nothing.
So baby,
So mother will transmit the disease. Dr. O. Muhammad, do you like to say, what will you do?
You see, her mother is she has the disease and she is infectious, huh?
So how will you prevent the vertical transmission? You can say, mother, don't take baby in
No,
future.
Infection.
But mother wants to be mother. In fact, what will you do?
I
C-section.
will give immunoglobulin
Cesarean
and
section. Cesarean
Yeah.
section, you mean appropriate strategy for reduction, doctor, not prevention. You can you can minimize the risk. So cesarean section, you are thinking one option for the delivery. Okay.
Mm.
Any other option? Please look at and choose your answer. Look at and choose your answer. A little long sentences are there. Read it and try to understand.
So E, last one.
Give mother hepatitis B immunoglobulin shortly. Can you read it shortly before birth? Plus newborn hepatitis B vaccine.
To reduce the
So
vertical.
you are not giving immunoglobulin to the baby, you are giving immunoglobulin to the mother. Mother already have immunoglobulin a little or almost no. So you are treating the mother. You are treating the baby by vaccine only.
so A, sir.
So do you think that this transmission will be lessened by this? E, I am asking the E. Again, another option, Dr. Ashraf telling maybe?
A, sir.
A, give newborn hepatitis B vaccine, okay, plus hepatitis B immunoglobulins. That means you are doing nothing to mother.
Maybe D, give the mother intravenous
Okay, we will
during
come
labor.
to the D later. But as Dr. Ashraf saying, Dr. Ashraf, you are giving hepatitis B to the baby and immunoglobulin. That means you are treating the baby, not mother.
Yes,
Right?
sir.
Okay, D.
Yes, sir.
Now come to D, Dr. Nasser. You are giving intravenous zidovudine. That means antiviral drug during labor. That means you are giving only mother. You are doing nothing to the baby.
Because we are reducing the vertical transmission before delivery or something like this.
You are trying to kill all virus in the mother. Is it the treatment of pregnant mother with hepatitis B? You are thinking? Possibly you are confused now.
Baby
Yeah.
is born.
Is it the treatment? IV zidovudine is the treatment for hepatitis B. You are confused, right?
The
You are
baby
confused.
is already born.
No, not born. Baby will be born
Oh.
later. Vertical transmission, what does it mean? At the time of delivery, placental transmission. Or at the time of delivery, placental separation.
Oh.
Not after birth. That is, even after delivery also, we will give the treatment to the baby for the sake of the baby's health. That means baby will not have virus, or even baby will have the virus few, it will be killed by the treatment.
So
The
then
concept is
answer
like
will
that.
be D and
Concept
E.
is like that. This is a pregnancy related transmission.
So answer E, sir. Sir, understand.
E, now you jump to E now, Dr. Ashraf.
Yes, sir.
That means you are you are giving some treatment to mother and some treatment to baby. Huh? Mixed up. Opportunistic answer. What you will do the mother here? Mother chronic carrier. Understand now?
Yes,
Actually,
sir.
we have to treat the baby by the vaccine and immunoglobulin.
The question should be understood.
That is the
Understand.
thing. Question should be understood well. Okay.
So, question, the last line is confusing. I am thinking about how to reduce the vertical transmission. So better to go to treat mother. That's why.
No. Vertical transmission means the time of
The mother
delivery.
is already infected.
Infected chronic hepatitis B. We have to
So
treat the
we
mother
cannot.
as protocol of the chronic hepatitis B treatment. Okay. There may be
Yes.
some other the tenofovir or other.
But
There are
still,
many
but
drugs.
still, sorry, sir. Still, I have question. What is the most appropriate strategy for reducing the vertical transmission rate?
This is the best way. They are not asking absolute, not 100%. Mostly, if we give newborn hepatitis vaccine and hepatitis immunoglobulin. First give immunoglobulin, then already I have shown I am going back, doctor. There is a schedule. Just jump there. I told you, you will read it. Yes, this is the thing. Understand? This is the plan. Immunization to the baby. We will give the vaccine 2 month, 3 month, 4 month, and one at the birth. Another is 1 month of age for the dose. Okay. And immunoglobulin within 24 hours after birth of the carrier mother. Clear now, Dr. Nasir? This is the answer. This is the answer and description of the question. Okay. This is the schedule. If you don't know the schedule, no worry. Just minimum remember the principles. You see, they are not asking the time, which month. They are asking the principle. You will give the immunoglobulin, you will give the vaccine to the baby.
Sir, in the perspective, the patient is already hepatitis B infected mother.
Yes.
And baby is we don't know. We need to prevention to give the vaccine for baby. So in that case, we give the vaccine for the fetus. When after delivery, she cannot be infected anymore.
No.
So
How can you give the vaccine to the fetus? It is possible.
No, sir. So mother.
After birth. No. Mother, actually, after giving the vaccine, do you think that vaccine will go to the body of the fetus through mother body? Not so.
Not so.
Yes, vaccine will act in the mother's immune system. Actually, mother will do nothing to the vaccine. Mother already have infection. Now vaccine will do nothing for the mother, unfortunately. So at the time of vaccination to the mother, no benefit. So though it is written vaccine earlier, actually our step will be early immunoglobulin followed by vaccination schedule. This is the plan to the baby. So it's a very important question in your exam.
Yes.
How long will you be continuing, doctor? More than 1 hour happened. Should we continue?
Yes, sir. It is almost 1.5 hours.
Near about. So do you, no break, but we have to finish also. There are some few things remaining. A little. Anyway. HIV. You see, 50% of infant of the HIV seropositive mother are pre or perinatally infected. Again, the hepatitis B transmitted at the time of delivery more. Okay? Understand? At the time of delivery, pre or perinatally. That means perinatally also. Now, avoidance of breastfeeding again. There is a controversy. The mother will give breastfeed to the baby or not if mother is HIV positive. Previously, it was discussed that don't stop breastfeeding if mother is HIV because the breast milk value is more. But now a strategy possibly a little modified in the Western countries especially, that there is a chance to collect the breast milk from other mother. That means the breast milk donor. If a scope is there, definitely avoidance of breastfeeding will be good. Okay. And mother will be treated for HIV later on. That means after the delivery of the baby. And during the pregnancy, if you came to know that mother is HIV positive, so fetal anomaly scan is important if it is in the first trimester. To the antiviral treatment, if you treat mother at the time of pregnancy, that means during pregnancy, we can treat HIV mother. But as a GP, we have to have consultation to the specialist clinic, HIV clinic or a specialist. But we need to know the informations that if I give or clinic, a special clinic, give treatment for the HIV, there is a chance of drug-related problem to the fetus. So in the first trimester, if antiviral treatment given, there may be fetal anomaly. You know, the first trimester is the risky trimester. Okay. Not only antiviral, if you give any folate antagonist drug, it can cause also morphological malformation, teratogenesis. Okay. And there is a chance of increased congenital problem. Okay. So in this case, actually take specialist advice. Don't do by yourself. This is the HIV related message as a GP. Now, a question related with HIV. Who will read, please? Nobody is interested. Sorry for you. I will better if you read. Otherwise, I am reading. 22-year-old woman confirmed with a positive pregnancy test. She is now known to be HIV positive. So, following should not be part of management plan to ensure an optimum outcome. Which will you not do? This is the question, a negative question. What will you not do? That means you can do other 4 things. One thing you will not do. What? From there?
See,
Answer is already discussed before. Right? That is the encourage breastfeeding. And that means I will not encourage breastfeeding. But in South Asian country, it will create the confusion, I know. But for standard reference, we need to know breastfeeding is not encouraged in HIV situations. So formula feed from birth, or better, it is called milk mother. Do you know about milk mother? Doctor? Do you
No,
know
sir.
milk mother? I think all of you know, especially those who are the Muslims, you know that. But about the milk mother of our Prophet, Sallallahu Alaihi Wasallam,
yes,
you
sir.
know the milk mother. So this is
Sir,
the milk mother culture, and this is justified in religion also.
sir,
Milk from the other woman.
Milk
Other-
from other mother.
other woman, yes.
I'm just using my word by myself, milk mother, maybe another word, I don't know. I'm just recalling this thing. That means, so better in the health perspective, we discourage mother, HIV positive mother, to give the breast milk to the baby. So collect the milk from other mother. Or if not possible, formula feed, artificial feed, they're advising. But South Asian country, a little different stance. So these are the details, doctor, you will read. Antiviral therapy, infant feeding. Now something about the moms. What is message? Not been associated with increased risk of premature delivery or birth defect. Is it good news or bad news? Doctor?
Very good news.
Very, better to say good, not very. That means assurance. So if pregnant mother having the moms, we are not too much serious about the baby. But nothing is 100%. We will be vigilant. We'll treat the mother as usual by the treatment of for the treatment of moms, paracetamol, painkiller, plenty of fluid lifestyle and other. Again, we will tell don't be in touch with other pregnant lady or other, right? As usual, to prevent the transmission. Okay. Somebody there is a risk, but somebody in the research telling that there is no risk. So almost no risk of the fetus by the moms. Don't be confused with the measles. Measles, moms, similar word. Don't be confused, moms. So how moms treated during pregnancy? As usual, But again, safe to have MMR vaccine after baby is born, even in the breastfeeding. That means advise the mother after the delivery. That means you are treating the mother that take the vaccine. Does mother take mumps vaccine at the time of pregnancy? What is the answer? Mother telling that, okay, doctor, I will take the mumps vaccine now. Will you agree?
Yes.
At the time of pregnancy. Is a mumps
Af-
live vaccine or not?
Not yet.
After the delivery.
After the delivery. I am asking at the time of delivery. Sorry, at the time of pregnancy. During
No.
pregnancy.
No,
No.
sir.
Sorry, if I am having the slip of tongue. At the time of pregnancy, no. Okay. And what is that? Quarantine. 5 days after your salivary glands begin to swell. Minimum 5 days, she will make distance from husband or other children. This is also important as a family physician. Okay. Now the UTI in the pregnancy, as usual, important thing is that we need to choose antibiotic which will not be harmful in the pregnancy. And in the recurrent pregnancy, we need to check ultrasound after 3 weeks. After 3 weeks after delivery, renal ultrasound. Renal ultrasound after delivery. That means the mother, we will check the mother well, treat the mother. Okay.
Yes, sir.
This is one thing. Second thing is screening of UTI in the pregnancy. For that, we are checking urine analysis in the booking visit, first visit. There may be asymptomatic bacteriuria. It is also harmful without any symptom. We need to treat. And after treating, check urine again to ensure infection is cleared or not. Usually, do we check infection cleared or not in other situation other than pregnancy, doctor? We are giving antibiotic, okay, go, finish. No need to come back. Usually, but especially for the pregnancy, it is our job to check the infection cleared or not, because if any something miss or something happened wrong, infection is not controlled or treated, it can damage the fetus. The reason for that, we will recheck, because both untreated bacteriuria or UTI, frank UTI associated with preterm delivery and IUGR. So it is hazardous. Mother UTI is hazardous for the baby.
So duration of the treatment will be for 7 days?
7 days
Cephalaxis?
minimum, because it is like complicated UTI. Complicated UTI needs minimum 7 days antibiotic. Uncomplicated is 3 days. Complicated antibiotic 7 days, even 2 weeks also. In some other disease, suppose prostate, few weeks also, prostatitis is UTI treatment. So again, come to a case. Dr. Nasir, as you are reading before also. Can you read it?
Yes, sir. A 33-year-old woman is seen at her antenatal appointment at 34 weeks gestation. A vaginal swab taken several years ago by her GP tested positive for group B streptococcus. Several years ago. She is concerned about GBS infection, Guillain-Barré syndrome, as her sister's baby.
Guillain-Barré, no.
Oh,
GBS
sorry.
is group B
Sorry.
streptococcus.
Yeah,
Group B
she's concerned about GBS infection as her sister's baby developed GBS infection shortly after delivery. What would make her eligible for antibiotic prophylaxis?
That means, will you advise this lady antibiotic or not? It is called intravenous antibiotic in pregnancy. One term, IAP, possibly intravenous antibiotic for pregnancy. Should we give or not? Okay. In which condition we will give antibiotic for prophylaxis, or like that? What I will show you. What is the background here? Keyword: a vaginal swab taken several years ago. Several years means not recent, many years before. I'm making red again. Test is positive, vaginal swab. So it's a vaginal infection we are discussing now. Okay, but She is concerned GBS infection because her relative sister's baby developed GBS. That means she is thinking she also will give a baby and the baby will develop infection. Understand? So in which situation you will give the treatment to prevent again GBS? This is the question. Can you read in the screen, Dr. Nasir? All of you please read it.
Yes, sir.
And choose your answer.
Positive.
That is, you will advise for antibiotic prophylaxis.
History of infection is the previous baby.
History of infection in the
Previous
previous
baby.
baby. Previous baby means vaginal swab, tested positive.
Not mentioned.
Huh?
Did not mention.
Oh, if this mother, today 33-year-old lady, previous baby around 1 year before, right? If she has another baby. At that time, if she has the infection, now you are giving the treatment for, you are thinking so, okay? One answer. Another answer? Try to understand the meaning of the option. Otherwise, your answer will not be correct. Pre-gestational vaginal swab. Before pregnancy, if the swab done and swab positive, now we will give treatment. This is one option. Positive
Sir,
swab. Sorry.
Okay.
That means the positive swab at the pregnancy, but negative swab at the labor time.
So I think D, positive pre-gestational vaginal swab.
Pre-gestation means 9 months before, 9 months, 7 days before. At that time, it was positive, but at the pregnancy time, not positive. At the labor time, not positive. Then you are giving antibiotic at the time of delivery right now, or 34-week gestation near about the delivery time.
So B answer.
B, previous history in the baby.
History of infection in the previous baby. That means this mother will transmit the disease again to the baby in the current time. A little thoughtful answer are here, right? Not easy to understand.
Yes, sir.
Not easy to
Complicated
understand.
question.
Complicated question. It is called intravenous antibiotic prophylaxis for the group B streptococcus disease. History of infection in the previous baby is correct. Not the sister's baby is correct, right? There is one option, sister baby.
Yes, sir.
Okay. But
Sir, what antibiotic we give in?
benzyl
GBS?
penicillin. Benzyl penicillin. Benzyl penicillin. Another message you see, multiple pregnancy is not correct. Being pregnant with 2 or more babies at the same time is, however, associated with a high risk of preterm labor. And the preterm labor is indication for treatment. Would be indication for maternal intravenous antibiotic. Understand? Is there any additional message? If preterm labor is there, that means at the time of labor, the patient have the preterm labor, you give a prophylactic antibiotic, okay, to the mother. Many other messages are there. Benzyl penicillin is antibiotic of choice for GBS prophylaxis. Okay. And these are some other condition. It is in from you direct from the textbook. These are from your learning material. Similar, almost similar messages. I just customized and prepared the slide, a total slide. GBS detected in urine in pregnancy. Many, I think a snapshot will be useful for you. Treatment of all these infections should involve treatment of all those infections. That means what we discussed or we didn't discuss. You will read by yourself. The treatment always not by myself alone. Okay. I will lead, I will make and communication. We have to take input from obstetrician, infectious disease specialist and neonatologist. So it is a multidisciplinary team approach. Remember it. For the congenital CMV infection, okay, pregnancy over, baby is born, but audiometric evaluation further 6 years of age, minimum 6 years, there is still chance baby may develop the deafness if mother have CMV infection, cytomegalovirus infection. So this is the further workup or further monitoring after the delivery. And B19, though it is not much common, parvovirus, intrauterine B19 virus infection, monitor psychomotor development. That is the, in the baby, BIND, we discussed, right? Birth, immunization, neonatal, the nutrition, and the development. So we need to follow up for psychomotor development of the baby. Milestone. That is, these diseases are related with the milestone problem. Again, the rubella, a lot of things are there. Two important issues, psychomotor development and the audiometric evaluation is important after the birth of the baby for future. We are at near about end, doctor. Be with us few minutes, if possible. Some antimicrobials in the pregnancy. Interestingly, common antimicrobials we are using, we can give. It is not known that this is harmful. Remember the word, not known to be harmful. They are not telling it is safe. For that in the pregnancy, the medicine is categorized by Americans, though, A, B, C. Pregnancy category A, pregnancy category B, like that. So there is some update of this, but still it is valid. So not known to be harmful. Actually, it is not category A. It is category B, more likely. Or some category maybe from the C. So most of drug we are using in the pregnancy, usually category B. So not known to be harmful. So you see acyclovir, cephalosporin, clarithromycin, clindamycin, erythromycin, penicillin, meropenem, antibiotic commonly we are using. There are some other contraindicated drug. Try to remember it, doctor. As you are the doctor, you will treat. If I don't know, do you have any further interaction or not? Otherwise, this is our group, doctor, for further communication with us. And for OSCE, doctor, I am just sharing. If you are any new colleague today, please give me a few seconds. I am giving in the chat box where it is. Sorry, doctor, a little changed appearance here. The link I am sharing for the AKT group, you want to join. And the next message in the chat box of the Zoom, you can see our OSCE group address. So separately I am giving. We will feel proud and we will have gratitude to you if you join with us in our journey. We are trying always to guide you and help you. You will pray for us as well.
Thank you, sir. Very excellent session. So nice.
And with a few words, we like to thank you very much for your kind presence with us. Thank you, doctor. Thanks.